Hi everyone, this is Dr. Sue Doyle here and occupational therapist, and I'm going to answer a question that I get a lot. So I'm getting therapy in the home. Is it home health? Is it outpatient? What is it? And why does it matter? Let's go ahead and take a look there and see. So if I'm seeing patients in the home, I must be home health, right? Well, maybe. There are two ways patients are generally seen in the home. One is a home health episode of care, but there can be a mobile outpatient therapy service. So let's look at the difference. What is home health? And I'm going to use the definitions here from CMS Medicare, and there's a link I'll put in the comments below on this YouTube video. But home health is a care, offers a variety of services. You know, the CMS says that they need to offer skilled nursing, occupational, physical, and speech therapy, and medical social services. So they're supposed to offer this comprehensive services to meet your needs or clients' needs in their home. Generally, this is seen as short-term, right? So it's recovery from an illness or an injury. Usually, you've just come home from the hospital and you need a little bit more care, but they're sending you home earlier. Sometimes being discharged from a skilled nursing facility. The goal is to get you better, regain your independence, and become as self-sufficient as possible. Then there are some long-term home health goals and situations. This is for people who are chronically ill or significantly disabled. And this is to maintain your highest level of ability or health and to help you learn to live with your illness or disability. So there's some of the requirements of home health care, but who's eligible? Well, there are all these list of 4 requirements that need to be met for it to be home health care. So first of all, a doctor decides you need to have this medical care at home, and they write that, right? And you must, for that to be true, need at least one of the following. Intermittent skilled nursing care, so it could be wound care, it could be monitoring vent, it could be breathing treatments that you can't do at home. Physical therapy, speech therapy, or continuing to need occupational therapy. You must be homebound or normally unable to leave the home unassisted. Now, to be homebound means that leaving the home takes considerable time and taxing effort, and a person may leave the home for medical treatment and short, very infrequent absences for non-medical reasons, such as going for a trip to the barber or to attend a religious service. A need for an adult daycare doesn't keep you from getting home health for other medical conditions. So those are 3 conditions, and then the home health agency that's caring for you has to be approved by Medicare or Medicare certified. So that is going to get those services covered. Medicare home health care doesn't cover the following. It doesn't give you 24-hour day care in your home. It doesn't cover your prescriptions drugs. You don't get meals delivered to your home. And it doesn't cover homemaking services like shopping, cleaning, and laundry. Now, while you need therapy or nursing services, you can get a home health aide that will help you with bathing, using the toilet, or getting dressed. But once those other services are no longer needed, you cannot get a home health aide under the home health care program. Now, home care is different to home health, right? Home care provides you that care, but it's not covered generally through Medicare. So home health care is very different to home care where you can get that other care. And you will see there are non-medical home care agencies that provide that kind of home care service, but don't provide home health because they don't have the therapy services and all of those other skilled services available. How much does this cost? Medicare covers the full amount for home health services. And you might receive some charges, though, for some prescription drugs or medication type things that you need, like wound dressings, etc. They also cover 20% of the amount for things like a wheelchair, walker, hospital bed that you might need. If the home health agency can't supply them themselves, then those will be supplied by a medical equipment company who should be notifying you about the cost that you will need to cover those. Generally, this is paid for under your Medicare Part A benefits in Original Medicare, right? And that's the same that paid for any in-hospital services or in the skilled nursing home services. And generally what happens is Medicare pays this home health agency a set amount of money for 60 days to provide the care that you need. This is called an episode of care. This is different to mobile outpatient therapy. In order to bill, the mobile therapist still needs to be accredited just like the home health agency did, but it's under a different kind of program. And they're enrolled or accredited either as a private practitioner that is working for themselves or as a group of practitioners, right? In a partnership or a group practice. And so it just depends on what's allowed by state law. And the private practice isn't someone that's working at the stage for a hospital. It's usually just they're working out in the community. Now, Medicare says that services of those private practitioners can be provided in two places. One is the office, what we all know about. We're going to go to the physical therapy office, we're going to the OT office, or we're going to the doctor's office, right? Because they're all covered under Part B. But the second place that's allowed is your home, or patient's home. And that's certainly a place where those services can be provided. So they either have a private practice office or office space that they get to use exclusively for the time that is nominated by the therapist, and you can go there, or they can choose to come to your home. And we're seeing a growing number of therapists providing that mobile outpatient service. And it's not home health because it doesn't come with all that large group of agency. Such as needing all of the therapies, needing the nurse, and needing the social services. It also doesn't mean that you're homebound. And so that's a big difference with what happens with those services. And also the other difference is how it's paid. And remember, home health care was paid under Medicare Part B. Under A, outpatient services, whether they're provided at the therapist's office or in your home, are paid if they're medically necessary under Part B benefits. That's your outpatient coverage benefits. And here again, Medicare covers 80% of that scheduled fee, like they did for equipment, but for home health care, they covered all of the therapist costs. If you have a Medicare supplement plan, it may cover the other 20%. Now, if you have a Medicare Advantage plan, remember that's his Medicare Part C plans that we're talking about. Again, this is a commercial insurance, a private commercial company that has taken over managing your Medicare for you. And they'll each have their own different payment schedule, and most have a co-payment for outpatient therapy services. So you'll need to check on that. If you have both Medicare and Medicaid, and they're straight Medicare and Medicaid, you don't have an Advantage plan that's taken over both, then Medicare covers 80% of the therapy schedule if it's medically necessary, but that 20% co-insurance is waived and is not paid to the therapist due to the fact that you have Medicaid. They can't charge you those other fees. Can you have both home health care and outpatient therapy services? If you qualify for and are receiving home health services, even if only for intermittent nursing care, for wound care, for example, then the home health agency should be providing all of your medically necessary therapy. So anything that's medically necessary and being billed to home health, being billed to Medicare under that stage should be covered from the home health agency. And if you had an outpatient therapist coming to your home, they wouldn't be able to get paid under Medicare Part B because Medicare won't pay Part A and Part B at the same time. right? So if you are getting extra therapy, there is a way that you can pay cash for extra, but that would be a cash payment, and that's something you'll need to sort out with the therapist. And this would not be for medically necessary services. This would be for additional services to help you where your caregiver can't help you. For example, what if it's not Medicare? Well, we talked about Medicare because as a rule, Medicare sets the general guidelines that most insurances follow to some degree. Each insurance will be slightly different. Some insurances will not cover treatment in the home and the community on an outpatient basis. And Medicare doesn't cover other locations except a pool, and there's some strict rules about that therapists need to follow. So again, you need to check out all of those options first carefully. But how do I find a therapist? Well, if you're looking for a home health agency and you qualify, there is called the Home Health Compare. Medicare does that on Medicare.gov, and you can type in your address there, and you can find the home health care agencies in your area, and it also gives you a comparison about how they're rated. You can ask your doctor or your discharge planner. You can ask Senior Care Services or even the local area agency on aging and disability. Their office can give you the names of local home health agencies that are going to be able to provide home health. You can Google it if you put it in as home health, not home care. You can do a phone search. You'll often on those Google searches on your phone or on the computer, you will find reviews. You can ask neighbors and friends who've experienced it. How do you find a mobile outpatient therapist? You know, this is not as common as you think, and you're seeing a lot of confusion. People, including the doctors or discharge planners, not understanding the difference between home health and mobile outpatient. But you can ask them about them. Some doctors may have been educated and may be aware who's in your area. You can also ask the area agency on aging and disability office. You can Google as well and look for mobile therapist. There's also a website called MedicareHomeTherapy.com, and that's a directory of mobile therapists that you can look for and ask questions about that. So I hope this has been helpful to give you an understanding of just because a therapist or I want a therapist in my home, that doesn't mean that it's home health. There are a couple of options, home health or mobile outpatient therapist. Each one has their place, and each one could provide you with a service that meets your needs. It's a matter of you working out with your healthcare providers what is best and what's going to meet your needs at this time, and being aware that both of them are available.